Hello everyone. In this video we'll be learning about few homeopathic remedies and their indications in hemorrhage. Describe the indications of Arnica and Haemorrhage in hemorrhage. First we'll be dealing with Arnica, then Haemorrhage. Arnica, ailments from bad effects of mechanical injuries even if received years ago. Falls, blow, hard work, contusion and concussion. Ailments, mechanical injuries, blow, fall, hard work, contusion, concussion. The sphere of action. Where does Arnica prominently acts upon? It is on the blood vessels, particularly on capillaries. It is generally believed to possess the power of absorbing the blood. Acute injury, sensation, sore, lame, bruised feeling all over the affected parts. How will be the sensation in the acute injury? You will have a sore and a bruised, lame feeling in the affected part. The pain very much painful, sensitive to touch. Affected parts become blue and black with extravasation of blood. Extravasation is leaking out of the blood, oozing out. There may be injury to the conjunctiva and retina due to coughing. There will be so much pressure during the coughing that there will be injury to the conjunctiva and retina with extravasation of blood. There will be escape of blood in the eye. Again, sore, lame, bruised feeling in the eye. After difficult labor, there is soreness of the part. In acute cases of injury, Arnica is given, the above mentioned symptoms are found. When you prescribe Arnica to a person, what are all the symptoms found? It will control the hemorrhage, it will reabsorb the extravasation of blood, the extravasation of blood in the eyes, it will reabsorb it. It prevents the suppuration and septic condition, that is infection. It prevents the postpartum hemorrhage and puerperal complications. That is, after delivery, there will be postpartum hemorrhage. To prevent that, Arnica is prescribed. Let's summarize. In acute injuries, how will be the feeling? Sore, lame, bruised feeling. How will be the pain? It will be very much painful. It is sensitive to touch. And then there will be extravasation of the parts, extravasation of the blood. Whenever there is extravasation of the blood, there will be cyanosis, that is blue and black discoloration. In the eye, again extravasation, sore, bruised feeling in the eye, and after difficult labor you give it, and puerperal complications and postpartum hemorrhages. Then if you prescribe Arnica, what all it does? Absorbs the blood, controls hemorrhage, prevents infection, that is suppuration and septic condition. Now let us head on to the chronic injury. Chronic injury resulting in tremors, rheumatism, paralytic and paretic condition of parts. From the chronic injury, what is the person suffering from? Tremors, rheumatism. These are all like chronic cases. Rheumatism, 20-30 years rheumatic people. Paralytic and paretic conditions. Arnica is infallible. Concussion of the brain received years ago. There is an involuntary evacuation of urine and feces. So, when there is a concussion of the brain which is received years ago, what will be there in the patient? Involuntary evacuation. Without the will of the patient, there will be urine and feces. Modalities: aggravation from touch and motion, amelioration from lying down. Thermals: Arnica is a chilly patient. Hope you're clear with Arnica. Let us move on to Haemorrhage. Ailments from trauma or injury, hemorrhage, etc. Sphere of action: Haemorrhage will act on veins, capillaries, portal system. Hemorrhage: it is better adapted to passive venous hemorrhage. When there is arterial hemorrhage, it will be active. There will be spurting of the blood. But in case of venous hemorrhage, the blood oozes out slowly, which means it is passive from any orifice of the body. From the nose, rhinorrhea. In the lungs, hemoptysis. Stomach, Hematemesis. Bowels, melena. What is melena? The stools which are containing blood, that is melena. Bladder, hematuria. Hematuria is nothing but the blood which is present in the urine. Uterus, there will be menorrhagia. The character of the blood is profuse, dark, grumous. Hemorrhage after a fall or rough riding. So let's summarize. It is from all, where does it act? The hemorrhage, veins, capillaries and portal system. That is veins. Portal system also, it is veins. And then what does it do? Venous hemorrhage. How will be the hemorrhage? It will be passive from all the orifices of the body. From the nose there will be rhinorrhea, lungs hemoptysis, stomach hematemesis, and bowels it will be melena, bladder hematuria. Then the character of the blood, how is the blood here? Profuse, dark and grumous. Hemorrhage is, how does it occur? From a fall or rough riding. There is intense soreness of the affected part. Varicose menstruation is also found in it. Now, individually, nosebleed. The causation for the nosebleed is idiopathic, traumatic, vicarious of childhood. Flow is passive, as we mentioned earlier, long lasting and venous. Blood is non-coagulable, profuse, which relieves headache. So after the hemorrhage, that is from the epistaxis, that is bleeding from the nose, there will be relief of the headache in this hemorrhageous patient. It hastens the absorption of intraocular hemorrhage. Hemoptysis. Ticking cough with the taste of blood or sulfur without effort or coughing. How is the cough? Ticking cough. And what taste is the person getting from the cough? He's getting a taste of blood and sulfur. Sometimes it lasts for months or years, the cough. Chest feels sore and constricted. Aggravation from motion and exertion. Hematemesis. Throbbing pain in the stomach. Hematemesis is nothing but vomiting with blood. Profuse bleeding, dark blood. Here, everywhere it is profuse bleeding, it is dark blood, soreness in the abdomen, hemorrhage from intestine during typhoid or dysentery, profuse bleeding, dark blood. Anus feels raw and sore. Aggravation from motion and exertion. Hematuria, dark blood with the increased desire to urinate. To summarize, hemoptysis, what happens? The cough, it will be ticking cough. As of a taste, how will be the taste? It will be blood and sulfur. There will be, the cough will last for months or years. The chest will feel sore and constricted. Aggravation, motion and exertion. Hematemesis, same aggravation, motion and exertion. Hemorrhageis, motion and exertion from aggravation. Then throbbing pain in the stomach. Bleeding will be dark blood. There will be soreness of abdomen, soreness of the anus, and then there will be hemorrhages from the intestine. This is what you need to remember. Hematuria, dark blood with the increased desire to urinate. That is, the blood is present in the urine and the person has an increased desire to urinate. With this, we come to an end of Arnica and Haemorrhage. In the next part 2, I will be dealing with the other remedies, that is calcarea, carp, camphora, and so on. Thank you.